I'm Ted Owens, and welcome to Mountain Health Today, a program that is outreach to the community about a variety of healthcare topics. Today, our guest is the CEO of Tahoe Forest Health System, Mr. Harry Weis. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens. Our guest today is Mr. Harry Weis, the CEO of the Tahoe Forest Health System, and our topic is electronic medical records, also known as EMRs. Harry, welcome. Good to have you here.
Hi, Ted. Glad to be here today.
So let's jump right into it, Harry. What are electronic medical records?
Electronic medical record is an important transformation for healthcare, where we're going from a thick paper record to an electronic record, which really allows physicians, nurses, and others to, and lab tests, all different types of ancillary tests, to all be recorded electronically versus in paper form.
Which was, of course, the old methodology.
Correct.
And why is this an important thing nationally?
It's a huge advancement in healthcare from a technology perspective, in that practitioners really need to have a much more thorough health history. They need instant access to your health information. And when we had the old paper records, I might have a team of 10 or 20 individuals that was trying to find and pull those records and have them all available timely to a physician or nurse, which was a very difficult challenge. And then you had the challenge of legibility. You had the challenge if multiple people needed to see it at the same time.
Legibility, are you asserting that the physician's handwriting is not legible historically?
The manuscript grading probably has slipped a little bit.
So it's a very quick methodology. It's catching up with, of course, the modern times, everything going digital and what have you. But primarily, why are hospitals converting to electronic medical records?
For several reasons, really to improve quality, to improve efficiency, and also to engage the patient in their health improvement journey, which was really difficult if you had an old paper record.
I see, but also there's a federal mandate through the ACA, or the Affordable Care Act, that really began to drive this nationally. Is that?
That is correct. There are federal guidelines that if we wish to be a continued licensed and approved provider of health care, we need to do it through an approved electronic health record vendor.
So that's a massive transformation. Let's talk a little bit about that. So internally in a hospital environment, different service lines or different physicians that do different things can access my medical record instantly. That's one advantage, correct?
Absolutely. Anybody who has a need to know can instantly view your record, many persons at the same time.
I see. So if I had lab work done, that's fairly instantaneously available to my physician, or whatever physician I'm seeing for whatever purpose.
Absolutely. It's organized in a way that it would pop up, especially results that would be of concern, so that it allows the practitioner to see that quicker and to be able to communicate with the patient to define next treatment steps. And more importantly, if you've had health care in multiple locations, if you have the right electronic health record, there's some new opportunities that are available.
That actually takes it to a national. We travel, for example. People vacation up here at Lake Tahoe from all over the United States.
Right.
So I think the theory that you're trying to explain is that their medical record basically will follow them, or can.
Absolutely. We have chosen the EPIC electronic health record, which nationally is rated as the #1 most preferred electronic health record. So any health system across America, assuming there's the right to know, they can look in on significant health information that would be helpful for them if you're traveling to the East Coast. Even if you're just traveling east to Reno, EPIC is a significant player in the Renown system. If you were in South Lake Tahoe, Barton, if you travel to the west, Sutter, the UC system. And so this really improves the quality of healthcare so that practitioners can pinpoint how to treat you best and very quickly.
Well, since you brought it up, Tahoe Forest Health System is in the middle of a conversion to the Mercy Epic platform. Tell me a little bit about that. And there are different versions, I understand, but say Barton down in South Lake Tahoe, we'd still be able to talk back and forth. That's the idea, correct?
Correct. Different health systems access Epic different ways. Our partner is the Mercy Health System out of St. Louis, and there's a Care Everywhere type of feature that really allows all Epic users, physicians and hospitals, to really communicate and to show those most important findings that, again, really provide really precise medical history. So we're not just relying on the best recollection of the patient to their medical history when they're seeing a physician or nurse for the first time in a particular location. They can see even lab results or other types of medical information even from years ago. And even for me personally, I've seen how that helped a practitioner be able to trend certain results over 3, 5, or 7 years.
Well, I've been a bad player in my own health care where my physician is asking me perhaps to bring a list of medications that I may be utilizing at that particular time. I don't always do my homework, and I certainly can't pronounce it. So this would alleviate that problem in transfer of knowledge and information to a physician.
Absolutely. It's a huge advantage. I can't tell you the number of healthcare episodes in years past that could have been so much smoother, both from a patient and physician and nurse relationship, if we would have had the information that electronic health record would have provided. It would have made the pinpointing of the diagnosis, the treatment plan, the accuracy of it just so much quicker, so much more precise. So it's a tremendous quality improvement.
Well, it's definitely has a lot to do with patient safety, obviously, because you're getting correct information, getting real information, and that I would imagine makes a physician feel a lot better about the care that they deliver. We're going to talk a little bit about the importance of these types of electronic medical records to the patient. And if you don't mind, Harry, we'll do that in the next segment. Okay. You're watching Mountain Health Today, and we'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, and my guest is Chief Executive Officer of the Tahoe Forest Health System, Harry Weis. And we were having a good conversation about electronic medical records, some of the conversions that the hospital has been engaged in. In fact, by the time this airs, you should be up and running with the Epic program.
Absolutely. We've been on an exciting journey this calendar year, and on November 1, 2017, we're going live with the Epic electronic health record in our physician offices and in all of the in and outpatient areas of the hospital.
Now, you did say off air that's for the public to bear with us a little bit. It's a big conversion, so there'll be a little dust that has to settle, but it should go off fairly well.
A very, very good point. Our team have all gone through a lot of training and preparation, and they'll have mentors helping them in the first several days, several weeks, but I'm sure that their attention and care of each patient hasn't dropped, but their speed in handling each little episode might just be a little bit slower for the first few days. And we have some neat things coming down the road that are going to make that patient touch, that registration, and all those things better, down the road. But we just want to be open with our community that our team is going through a massive change on November 1.
Great deal of work. I know the study and the work that's gone in behind the scenes with staff, and as well as the utilization staff that has to learn how to use the system. Harry, I want to get back to safety and cost. Electronic medical records is really, we were touching on this, in the best interest of the patient from a safety standpoint. Right. Share with me how that is so.
What the robust electronic health record does, not only does it give us all of the history of our care with the patient, but with the Epic Health System, it tells us if they've used Epic electronic health records in any other location, and Epic is a dominant player in our geography of California. What it does is it really allows us to know, for those practitioners that have the need to know, exactly the history in a more robust way.
So let me interrupt you just for a moment. So what that means is, for example, with a clear picture, it might be a reduction of duplicity of some services, of maybe lab work or things like that that add to the cost of healthcare, because they'd be able to see that things were done.
Absolutely. You can see radiology history, laboratory history, previous hospitalizations, was it a medical or an injury issue, et cetera. And as they listen to the complaint today, all of that history, even potentially medications, that have been critical to the care of the patient, it enhances the quality of the history of that patient at least threefold versus the old paper world, which the practitioner is really just relying on the best that the patient can recall.
And that can lead to some abuse sometimes with, say, prescriptions and, in this era of great concern, opioid use, for example.
Absolutely.
So your medical record would follow, and if you were traveling, a physician would be able to see where your last engagement or access to healthcare was, what was prescribed, and be able to make a good, solid determination on whether or not it's real or an abuse, right? That's
absolutely. It allows practitioners to really understand what are real concerns and what potentially are low priority concerns. And it really does, it's going to allow hospitals for the first time, as more of us come on these systems, that it's going to really streamline that testing, lengths of stay. Outcomes will still be improved because it's not healthy for a patient to have a bunch of additional radiology exams, when they might have had them, 5 days down the road, 12 days down the road, et cetera. Now we can have access to that information.
Well, let's talk about the patient from the patient's perspective.
Right.
How is this tool a benefit for the patient's utilization? For example, MyChart. What is MyChart?
MyChart is the kind of the brand name, if you will, within the Epic software across the country for their patient portal that allows patients to sign in with a secure ID and password to be able to look at their patient medical record, a process that would have never been possible with the paper record.
Can I, once I sign in, can I make appointments for myself on that program?
You can ask for or request appointments. You can communicate with your provider confidentially on issues of concern. So it opens up new dimensions for care with you and your provider other than just face-to-face office visits. These are just huge improvements in the quality and the cost of the care, because all of these things, what they really do is they improve the quality of the care. And guess what? Once fully implemented, it lowers the cost of the care.
So when I go and see my physician, get a blood panel, blood workup done, typically I receive something in the mail. Now I would be able to log in on MyChart and see the results of that blood panel much more quickly too, I would imagine.
Very likely also, along your point of conversation, you might get an email prompt that you should go look at your MyChart because there have been changes to MyChart and see what are the latest updates.
What about paying bills? I can pay bills and what have you. Not that I would want to really, but I could get on my MyChart, see what my billing status is and be able to address it on my chart?
I think the billing issue is something that I'd still need to explore a little bit more, but this journey with Epic also brings more of our providers together onto one bill, so that it's going to lessen the volume of sources of bills that a patient would get after service is rendered to.
Okay. So what about immunization records? Is that available to me? We'll have to wrap in just a second, but...
Yeah, I believe those kind of things would be there as well.
Okay, so really what we're doing is getting into the 21st century, real-time, incredible access, better patient care, safety, cost, Harry, I have to say, good luck on your journey. I'm glad that you're embarking upon it, and thank you for spending time with us this morning and sharing this with us.
You're very welcome.
Thank you. You're watching Mountain Health Today. We've been with Harry Weis, the CEO of Tahoe Forest. It's been a wonderful visit. Thank you for joining us. Welcome back to Mountain Health Today. I'm Ted Owens, speaking with Harry Weis, CEO of Tahoe Forest Health System, and we're talking about electronic medical records and why they're important. Harry, earlier I misspoke. I stated that it was the Affordable Care Act that was driving this. It was actually the High Tech Act. So
you're correct. It is the High Tech.
I apologize for that.
That drives it.
So this, one of the things that strikes me particularly about the connectivity, the fact that we're located up at the north end of Lake Tahoe and Barton Hospital is down in the South Lake area. We have people that come to visit our regions from all across the United States to ski, to snowboard, in the summertime to mountain bike and rock climb and what have you. So even if they're from Vermont, Florida, Nebraska, in theory, as this all settles in, EMRs, their health records will follow them electronically wherever they go.
That is the long-term goal, at least at this time in our history. Epic is quite pervasive throughout all of those areas.
Meaning that Epic is one of the larger ones, and there were many different platforms when everyone embarked on this journey, but it's settled now down to a few big players, Epic presumably being the top of the heap, correct?
Right. And so if there is Epic in each of those communities, there will be that robust information available in each of those communities. Absolutely.
And I understand that Tahoe Forest Health System utilizing the Mercy Epic platform out of Missouri. Missouri?
Yes.
Is that correct?
Right.
That's unique, but there was some cost benefit to doing that. Share with us how that works.
We did a request for proposal, and they are the largest experienced provider, host provider in the country, and the quality of the content and also the cost is quite different host to host as well. So,
but that's a big host, and so we're able to tap into that by through
it's
Mercy.
A special strategic journey that they have created, business model that they've created to allow small healthcare providers to really avail Epic when typically it would be way out of the reach of Epic, of smaller healthcare providers.
So this will be able to, I would imagine that would be able to continue on, and it'll reach down to the smaller rural hospitals.
Absolutely. It's a very fortuitous strategy that they have that, as you say, will include many more rural hospitals, but it allows us to really honor our residents and our guests because very likely when they go back to their community, there's a higher probability than not that it is Epic. And so it's just the way we can honor our community with the very best electronic health record source.
So regionally, Tahoe Forest Health System is ahead of the curve in trying to implement this. Certainly Barton utilization of Epic as well. So it's more than a regional ability. It's the ability to really reach across state lines no matter where you're from.
What's really interesting is not only is it the clinical function, but the trailblazing that we've done on the business terms for it as well. That is a learning exercise for all other hospitals, large or small, to learn how to access this great system at a more effective price as well.
So it's very similar to introduction of any other product.
Correct.
It takes 10 years for the light bulb, for example, to end up in everybody's home, or the automobile before Henry Ford found a way to mass produce. So EMRs were very challenging cost-wise in the beginning, but it's beginning to spread out, and we're kind of ahead of that wave in utilization. Is it true that it has historically been typical for a hospital, your hospital, for example, to have different electronic medical record platforms within your own hospital?
Yes, absolutely.
I mean, in the past. I mean, that's another
Yes.
problem. But
And at Tahoe Forest, the story is no different. We have one system in the ER, a different system for the hospital, and a third system for the physician offices. And this journey brings us all together to one system, which is just amazing for our patients.
sounds like the building of the Tower of Babel, everybody speaking a different language.
Right.
So, and that's been the problem. Tell me a little bit about the staff that work for you. This is a big change for them. How many hours of training does it require, say, a staff person to, wean themselves off of the old system and learn this new Epic system?
The training that our users go through and our super users go through is many days of training. So it's not an hour or two here or there, but it's many days of training. And my hat is really off to all of our team of physicians, staff, all throughout the organization. We have a great team there. I'm really proud of them, and just want to thank them for really making this important journey with us to really honor our patients with Epic come November 1.
So that's a very big commitment on
big
everybody's
deal.
part.
Really proud of all the hard work that they're doing, and they're anxious to show and tell it as well come November 1.
So you had staff that are being trained, but also you had folks internally that were trained to be the trainers, correct? So
Absolutely.
that's an even larger commitment. So this is a benefit, I think, just kind of to recap everything. It's a benefit to the system. It really is a big step forward in terms of patient safety for all of the obvious reasons. And then it creates a great deal of convenience, both for caregivers, for the clinicians and the physicians, but also for the patients, because they can actually access their information on a computer screen anytime they wish, setting appointments, reading their own charts. They probably wouldn't like the billing capabilities, but it does make that easier too.
And the timing is really great because it is all those items that you just listed, but the product has matured and the cost equation has greatly decreased as well. So we have all of the variables in a more perfect timing than they would have been if we'd have tried to pull this off 2 years ago.
Well, the best of luck, and I know you'll be live by the time this airs. Thank you for joining us. I've had Harry Weis with me. I'm Ted Owens, and this is Mountain Health Today. Thank you for joining us on Mountain Health Today. Our guest, Harry Weis, the CEO of the Tahoe Forest Health System, shared with us quite a bit of interesting information on EMRs, electronic medical records. Please join us again soon for another episode of Mountain Health Today. I'm Ted Owens, your host. Thank you.